Good morning, everyone. My name is Melinda Antal, and in my thesis, I would like to discuss the optical and mechanical properties of dental ceramics. Allow me to introduce myself. I'm a dentist and a PhD student at Semmelweis University Department of Prosthodontics. My vision is to provide patients the best all-ceramic restoration, and my mission in this would be to supply dentists a guidance about the appliance of different dental ceramics. I have two specific goals for now, which are strongly connected to each other since both of them investigates a dental ceramic called zirconium dioxide, or shortly zirconia. In my first project, I would like to compare the mechanical properties of additively versus subtractively manufactured dental ceramics with the method of a systematic review and meta-analysis. Over the past 35 years, CAD/CAM has become an increasingly useful technology in dentistry. It basically allows you to produce all ceramic restoration even in your own dental office. When talking about this method, the manufacturing is mostly milling or subtractive manufacturing. Milling is widely available, but it has big flaws like wasting a lot of raw material that cannot be recycled and causing the wear of the milling tools, so overall it is expensive. Recently, a new method, printing or additive manufacturing, has emerged in literature. As you may know, printing is the method of building objects layer upon layer. There are many available techniques, but the two most popular ones are stereolithography and direct light processing, both based on the concept of photopolymerization. Printing has big potential because it could overcome the disadvantages of milling, like not wasting as much material and creating complex geometries with fine details and building multiple objects at the same time, so it can be overall more cost and time effective. But when we want to see if printed materials can overcome milled materials, we have to be sure that they are at least as strong as milled materials, and the best property to evaluate would be flexural strength, since it helps to predict the performance of a restoration. This is why my aim is to compare the mechanical properties of additively versus subtractively manufactured dental ceramics. This leads me to my clinical question. Do mechanical properties of dental ceramics differ when produced with additive versus subtractive CAD/CAM manufacturing? My population is dental zirconia. I would like to compare additive to subtractive manufacturing. My primary outcome would be flexural strength, and my additional outcomes would be Ricker's microhardness and Weibull characteristics. I hypothesize that additively and subtractively manufactured dental ceramics have similar mechanical properties. My implication is really simple: to provide patients better and cheaper restorations. Here you can see the details of my systematic search that I conducted in 4 databases, and after the selection process, I ended up with 203 included articles. On the upcoming slides, I would like to show you our partial results for 3-point bending strength. So 3-point bending strength is flexural strength measured with 3-point bending test. The unit is megapascals, and for zirconia, it ranges usually above 800 megapascals. Here you can see the details for our 2-armed studies. We included 9 in vitro articles that had similar weight on the outcome. You can't unsee the big heterogeneity, which is due to the fact that these articles use different brands of zirconia, different printing techniques, as you can see in the comment section, and sometimes different specimen dimensions. Our outcome is mean difference, and if the article is on your right, then the milled material was stronger in the study, and if it's on your left, then the printed was stronger. We have an overall mean difference of 182 megapascals, and although this is clinically relevant, it hasn't reached mathematical significance yet, meaning that printed zirconia is as good as milled zirconia, and although printed materials have come a long way and are really close to milled zirconia, there's still room for improvement, and they cannot be applied in the same indications yet. We included many 1-armed studies as well. Here we conducted a subgroup analysis based on the yttria content of zirconia. Zirconia has usually 3 to 5% yttria in it, and to put it simple, the more the yttria, the better the aesthetics, but the weaker the material. Looking at each subgroup, we can see the recently mentioned pattern, which is already well known in literature. So with 3% yttria, we have an overall flexural strength of 850 megapascals. With 4% yttria, it is only 680 megapascals, and with 5%, it decreases to 470 megapascals. Looking at printed zirconia, we can see the same pattern, with the only difference that there is no 4% yttria stabilized zirconia available for printing yet. So with 3% yttria, we have an overall flexural strength of 826 megapascals, and with 5%, it is only 646. What is really interesting is if you look at the printed zirconia, the 5% yttria stabilized zirconia in the printed group, we have similar flexural strength as the 4% yttria stabilized zirconia in the milled group, meaning that with 5% yttria stabilized printed zirconia, we can get really good aesthetical results without compromising for lower flexural strength. We did a subgroup analysis based on the printing method as well. Here I only want to show you the results for the two most popular techniques, which is direct light processing and stereolithography. So DLP produced zirconia has an overall flexural strength of 553 megapascals, and stereolithography produced zirconia has an overall flexural strength of 850 megapascals, which is really close to milled zirconia, which means that DLP-produced zirconia cannot be used in the same indications as SLA-produced zirconia, and that stereolithography-based zirconia has a really high flexural strength, which is really close to milled materials. Our study has the strength of including many one-arm studies amongst the two-armed ones, and most of our studies use standardized methods for flexural strength testing, and we'll be exploring all the methods for flexural strength testing as well, but these articles use different brands of zirconia, different manufacturing techniques, as you could see on the two-arm plot, and sometimes different specimen dimensions. Preliminarily, we can conclude that printed zirconia did not overcome milled zirconia yet. Our implication for practice would be that they cannot be used in the same indications yet. Printed zirconia could be as a temporary restoration, while for definitive restorations, we can use the milled material. Our implication for research would be investigating the SLA technology, which gives us zirconia with a really good flexural strength, and that there's need for standardization regarding the production of printed zirconia. Here you can see my target journals and my progress regarding my first project, and allow me to move on to my second topic, which investigates the effect of material aging on the color stability of dental ceramics. The introduction of improved materials and fabrication technique changed the aesthetic restorative treatment patterns and resulted in a higher demand for aesthetics in dentistry. This led to the worldwide spreading of all ceramic restoration, which can successfully mimic dental structures. Dental zirconia has excellent mechanical strength, and with the introduction of more translucent version, it can be applied in the anterior region as well. But whenever we place dental zirconia into the harsh environment of the oral cavity, it ages just like every other material. And aging can affect color. And since patients care mostly about appearance, color stability is a crucial factor throughout the functional lifetime of a restoration. This is why my aim would be to investigate the color stability of dental zirconia. This leads me to my clinical question. Does aging of dental zirconia affect its color stability in vitro? My population is dental zirconia again. I would like to investigate thermocycling, mechanical and chemical aging, and compare it to the material before aging, and my outcome would be color difference. I hypothesize that the aging of dental zirconia does not affect its color stability in vitro. My implication would be really simple again, to provide patients long-term aesthetical restorations. Here you can see the summary of my two ongoing projects investigating the mechanical and optical properties of dental zirconia. And allow me to thank for your attention with my favorite quote from Oprah: "Failure is a great teacher, and if you are open to it, every mistake has a lesson to offer." Thank you for your attention.
I have some questions for you. Please be patient with me. First, I'd like to understand what's the cost of a printed crown?
Thank you for your question. So the cost of a printed crown, it depends on the material that you are printing. But for zirconia, it is kind of the same price with like the milled version without the material waste. So the material price is cheaper as in milling, but printers are expensive. So there's no clear vision about that yet. More research needs to be done, but the material price is cheaper.
Okay, and considering that, thinking about the economic profile of Hungarian people, do you think it's accessible?
Not yet, because printed zirconia is only available in the USA. So first we need to bring them into Europe, and after that we will see, but it's still a really expensive material, so we have to consider where it can be applied and which indications, because it's not cheap.
And what could be any strategy to make it then more accessible, more popular for the patients?
I would say more and more research, standardizing the production, so we should investigate the factors that are influencing the flexural strength and the reliability of the material. And after we have a clear vision on how reliable this material is, we can motivate patients toward this resolution, this option.
You said that most of the printing techniques are based on light curing. So as far as I know, zirconium cannot polymerize by light. So probably this zirconium contains some polymer inside. And the second question comes from the first one, that is there any post-processing after printing of zirconium, like, for example, crystallization or sintering or something like that?
Thank you for your question. Yes, there is. So they basically, when they use photopolymerization, then they are printing from something called slurry, which is a liquid something that has zirconia powder in it. And after you polymerize it, it is basically zirconia and plastic. And you need a debinding process, so you can heat up the material, and the plastic content will go away, will evaporate, and after that you have a really porous material that you need to sinterize, and then it will be a smaller and more compact something that only consists of zirconia and yttria and other oxides.
And do they investigate the final stage, not the pre-sinterized or pre-crystallized?
Yes, the final stage, always the final stage. There are really few studies that are investigating the so-called green material, which is before sintering.
I have some limited knowledge about artificial aging, so can you give me some clue between the difference between thermocycling, mechanical aging, and chemical aging?
Yes, thank you for your question. So basically, thermocycling these are artificial aging procedures. So thermocycling is mostly about using different temperatures and water contents of the environment. Mechanical aging is mostly when they simulate toothbrushing on the material, and chemical aging they are simulating, for example, an effect of acid reflux, so they are applying something with a low pH to the material, or even high pH.